It was recognized early on that we needed a strong analytical partnership, and so that was the driver that really pushed us to reach out to analytics and engage them as one of our key strategic partners in really transforming all of rehab services for OSF.
Our therapists are very knowledgeable and they like a lot of why. Why am I asking for this? Why are you not asking for this? And to have that hardcore data to show them what I'm looking for and to be able to pull that dashboard up, it's been very helpful to help them get the bigger picture.
The dashboard is a high-level performance dashboard that really focuses in on our leading indicators, our key drivers and key performance indicators. And so it's a dashboard that rolls up the performance of all of our rehabilitation services for the entire ministry. But then within that dashboard, we can slice it to see how we're performing within each region, each facility, each clinic, and all the way down to the individual therapist level to see how they're performing. So it really gives us a very clear line of sight into performance from a rolled up perspective all the way down to an individual perspective.
When we get the referral into Epic, how long does it take us for us to actually contact the patient? How long is it taken for us to get the patient in? When the patient's in therapy, how long are they here for? How many visits are they coming for? Are they coming around the average length? Are they staying longer? Are they shorter? How are we doing with our efficacy of treating the patient?
We've gotten to a point now where we're achieving the goals that we would expect and need to achieve for a ministry of our size. So it's been fantastic. And that really is a testament to our leadership team embracing the dashboard, embracing the tool, also them coming together to define that goal and that target and managing to it. And that really helps them in the communication with their teams, helps them really to measure performance of their regions or their facilities or clinics.
To be able to have that ability to look at the numbers and help it paint that picture for not only the mission partners, but from the patient's perspective, as well as help me be able to use this to paint that picture for others to see from start to finish, the productivity of the therapist, the number of units being done. The financials are on there as well to help us show this is the work we're doing, this is the bottom line. We are really helping to support the OSF healthcare and that we are supporting ourselves.
A lot of leaders want a lot of data, but analytics was a great partner in challenging that team around how are you going to use this? And so that was a fantastic example of how they pushed our leadership team to really think about the functionality of the tool.
I think overall it's just been a great relationship. I think it's really helped us hone in on areas we could improve because we have that data to back it up. I think it's helped me be able to communicate better with my mission partners because I have the data and the information.
Leadership team has formed a relationship with the analytics team around how they're using that data. I didn't know how connected they were and how much they understood the intricacies of the ministry. And so when we had questions, they had the knowledge to really help drive solutions and drive connections to people that would help with the solutions.
I really think getting that relationship built with whoever you're going to be working with on your dashboard is important, and giving them a fairly clear picture of what you want, but then helping them build that information to get to where you need to be.
And so that's really been a great tool to help us make sure that we have the resources necessary to provide the care to the patients that we're entrusted to.